Well, welcome to our podcast where we'll be discussing navigating difficult conversations. We're going to be discussing prognosis and lifelong care and PBC. My name is HoChong Gilles. I'm a nurse practitioner at the Central Virginia VA Healthcare System in Richmond, Virginia. And I'm joined by Ann Moore, my friend.
Hey.
And colleague.
Hi, I'm Ann Moore. I'm a nurse practitioner at Arizona Liver Health in Phoenix, Arizona.
So Ann, oh, thank you. It's always nice to see you. Tell me, when you're reflecting on your PBC patient experience and interactions, what topics consistently prove the most difficult to discuss? Is it chronicity of their symptoms or symptom management or prognosis? And what underlies that challenge?
Awesome. So I think you hit on the trifecta of difficult to discuss topics in PBC. These are not easy topics in the short amount of time we have to spend with patients. I think all three of them are somewhat difficult. With chronicity, it's difficult because patients are hoping for a cure or at least a short-term treatment plan, right? And so when you hit them with the idea that PBC is a lifelong autoimmune disease that's going to require indefinite surveillance and therapy, that can be really discouraging for patients. So also, especially if they aren't very symptomatic, it can be difficult to get them to understand the importance of ongoing monitoring and treatment to prevent progression, right? And then with symptom management, you know that fatigue and pruritus are like the most pesky and persistent. I always say that symptoms that patients can have, and we don't have anything good to manage them. And there's not always, they don't really respond well to available treatments, and patients can feel really like misunderstood, not heard, easily dismissed because we as providers don't really know what to do sometimes. So that's difficult to acknowledge the symptoms. Also, that they may persist even though you've controlled the disease. So you're controlling the disease, but you're failing at symptom management, which is really hard as a provider, but it's even worse for patients, I think. So you still want to offer hope, but it can be really hard to validate their experience and make sure that they're getting the care that they need and hopefully some relief. It's easier now with the new treatments we have, I think, a bit easier. So that's exciting. And prognosis is probably the worst. Like, thank goodness that we changed from primary biliary cirrhosis to primary biliary cholangitis, because that word cirrhosis can be devastating to patients. And when it's in your disease, title, that's really hard to get your head around. And so I think, we have a lot of tools to help us risk stratify, patients to help them to understand what their prognosis is. But then there's such a range of disease trajectories that we can't always predict well, right? And so I think that the fear of the unknown is real for patients. So I think that's difficult. So you have to walk a fine line between minimizing the risk and letting them know they have a treatable disease, but not overwhelming them at the same time, if that makes sense. So that
makes a lot of sense. Yeah, no, that makes a lot of sense, especially, in the asymptomatic, population, like you stated. It's hard, to make sure that they are adherent, they, follow up, because you don't want to scare them, but you also want to be honest about their prognosis and possible, progression where, they may need a liver transplant down the road. And, sometimes, depending on how, they present to your practice, they can have advanced cirrhosis, right? But I think, as you stated that, people come in various stages, but you want to give them hope, but also not minimize their significant risk of progression where they may need liver transplantation down the road.
Right. And I mean, these are discussions that just can't happen in one visit. This is like, these are like milestones for the patient, like emotionally, that are going to require time and development of trust and repetition. And so this is over, hopefully a lifetime of disease management where you're their provider and you can develop those that trusting relationship so that they can feel free to, open up to you about what they're going through with their disease process, right?
Absolutely.
Okay.
Absolutely.
Well, moving on. So HoChong, I have a question for you. So what specific communication strategies or tools have you found most effective in explaining PBC management and encouraging adherence, particularly with asymptomatic patients or patients who are just treatment fatigued?
Yeah, that's a great question. And I think that, I have the luxury of time with my patients. And like you said, you just can't overwhelm people. So you have to kind of deliver the information while establishing trust. So I think, what we do best as APPs is really, teaching disease state education. I often have resources, or point out resources that they can have. We have the internet, but we also have, great, resources of patients that we didn't have like 10 years ago. Right. So I think, part of it is to kind of teach back, say something and kind of reiterate and like, what does that mean to you? Or what do you think about that? Or, and really try to get them, because it's hard to get a bunch of complex information but you kind of have to kind of build on it, right? And that also establishes trust. It tells them, and I always say like, well, next time we'll discuss this, or, and, have them, explore, tell me what you think I said, or what do you think about that? So I think I have to not only teach them, but also have an idea if they're really comprehending what I'm saying. And it's also very helpful that, I always encourage them to bring their significant others or family members so that, they can have, they have an opportunity to ask questions, because as you know, that these diseases aren't just isolated to the patient, it's, the family network. So, and then I think, especially with asymptomatic folks, I think that, I'm not good at it, but I try to be better with motivational interviewing, especially, when people are very ambivalent or they're just completely fatigued, because I think that a lot of providers can be very dismissive of their symptoms because, we don't have great options. But that doesn't mean that we can't validate what they're saying or what they're feeling, right? And so I think it's also, when we're all busy, it's important to, listen to what they're saying. And also affirm, their symptoms and how it relates to their disease, So I think, a communication is a two-way street. And, I try to make sure that, repetition is required sometimes, because when you overwhelm people, I think that in most encounters, they're maybe catching like 15 to 20% of the things that you're saying. So, yeah, so it's kind of like, reinforcement. And I think that and those strategies can like really not only build trust between, because this is going to be, I always tell people this is going to be a long relationship that we have. Right. And it's also and I try to always respect their autonomy, but at the same time, drill it back to how important it is, their disease trajectory and what could happen. Unfortunately, even though if they do everything right, that they could still progress. That's the other challenging part, because they always like, what did I do wrong? And it's not something that, is blamed for. So, and then I try to use a lot of visual aids. It's hard, especially when you don't have, I don't have access to a lot of unbranded things, but I use the internet and, and I give them resources. And I think YouTube and, the American Liver Foundation. So I point them to sites that, that I often go to or recommend. So what do you do different?
Well, I think I completely agree with you. I think in PBC, normalizing chronic care, like treating, like sort of introducing caring for PBC, just like you would high blood pressure or just like you would type 2 diabetes. This is a problem that is going to be with you for the rest of your life. And it's normal. And you're going to have highs and lows, peaks and valleys, and we're just going to get through it. And that's, this is the way we're going to go down the road. And I like the tools, we have a lot of effective treatments to halt or slow progression. And so, really showing them like the green light, yellow light, red light, kind of putting their labs and their fiber scan in that kind of frame of reference. But when you have somebody who's, just treatment fatigued, like, and not really into taking their medicines, like I'm the world's worst at adhering to daily treatment regimen, so I get it. But really framing adherence as an investment in long-term wellness, I think can help them to re-engage in their care. Because, you can live a normal life pretty much to help them understand that, grasp that concept that if you can do this and stick with it, and we have great treatments, that your life will be less impacted by your disease, with adherence. So.
Yeah, the treatment too, for the fatigue part, I know I get these, like, you want me to exercise. I'm very specific about some of the recommendations that I've gotten better. It's like, oh, walk, or, so I've been doing, I was talking to a colleague, and they do I work with kinesiotherapists and physical therapists. And so I send them for actually exercise prescription. It takes a while. Yeah. And then, because that's not my specialty, but I know where to send them. But, and they work with them. And especially, some patients don't have the ability they have like physical limitations, so that they could work with them, to kind of optimize and reinforce some of the, those, health strategies or exercise strategies that could also maybe help them combat their fatigue, but it's kind of, debilitating sometimes. So how do you effectively integrate medical education about PBC with necessary psychosocial support for patients, facing anxiety and quality of life impacts?
So integrating education, I think, is about timing and pacing and holding back. Like, I want to just download everything, but with experience, you learn that overwhelming patients at diagnosis is not a good thing. And so really creating space over multiple visits to talk about the issues and address both clinical and emotional issues. You just don't want to just dump everything, because there's about 1 million things I could download, all the facts about PBC, and it's not what patients want or can handle most of the time. So really reflecting with them, like, how are you feeling about this? What do you want to focus on? Trying to listen. I mean, we have to be better listeners, and it's hard to listen in short visits, but it's so important, because what you think is important may not be maybe the last thing that the patient thinks is important. And really, making them, validating their feelings about the symptoms that they have, that they're real, they're common, they're manageable, all of those things, that it's not imagined. Maybe like the handouts that we use are really important. I think the PBCers organization has a lot of good information. So I like to connect them to the peer support groups, because if they're interested, I mean, some patients just it's not their thing, but others, they find it really valuable. Because shared experience is, it's everything in a rare disease. You can find somebody, it helps reduce those feelings of isolation and fear about what's going to happen to them. So I think those are all things, but also trying to get my team involved. Like, I'm in the community, so you have a village to help you, but I have, good behavioral health people, nutritionists, if insurance will help out there. I think just, embracing the whole multidisciplinary team to get the patient where they need to be without overwhelming them. So.
Yeah. And those are really great examples of best practices, Anne. I completely agree. I am very fortunate that I do have a village. So like, if I have, anxiety may not just be from their disease. It may be from other things that are impacting their lives or making them not as successful. So I'm very fortunate to have social workers and, I have access to a lot of behavioral specialists that, can help either with motivation, but also, stressors, and maybe they do a lot of, like they could do biofeedback or other, interventions that could help, manage some of their stressors and anxiety. But sometimes it's, what's limiting or is the social determinants of health, right? And it's not just maybe their disease states, but other access or other barriers to services. So I think that, that active listening is, very, very important, and trying to integrate them to that multidisciplinary team where they could, take the lead, because that may not be, that fatigue may not be the driving, symptom or their worry at that visit.
Yeah. So I think we've touched on a lot of great points with managing these patients. And just one more question I want to ask you. What team resources or collaborative strategies like referrals, materials, colleague support do you think is most valuable when you're navigating challenging PBC discussions?
Yeah, I think, we've already talked about the importance of, an interdisciplinary team, right? And so I'm sorry, I have a huge storm going on here, behind me, but, I think, I consult endocrinology a lot, with our, females, and make sure that they have, their bone health, and, not to forget about other things that could, like extrahepatic manifestations. Providing them all the materials and resources that I have. I think that we do need to develop better ones too, or update some of them. But just, engaging people with specialists that they need. And especially my social workers are great. Sometimes it's like, helping them navigate how to protect their jobs, like with FMLA or other things, because sometimes that's kind of, that's, the important driver. They want to make sure that they stay employed, but how do they keep their jobs when they're so fatigued and other things? So we want, that, I think that's a big thing that, and I want to support the patients, because that's a big fear. Like you have this chronic illness and then, you're worried about keeping your job, so I get those requests a lot. So I just want to make sure that, and anything that we can do to help them. And sometimes it's not just, hey, what's your alk phos today? You want to know what your alk phos is today? So, and I love it when my patients come back, well, what's my alk phos today? So is it better? So, and that can also, gauge some of their engagement in their health process. So, I think that linkage to the care that they need, and sometimes we may not be the primary person, of the team. And, the social workers usually save me, every day. So I appreciate them.
Right. I think no kidding. I feel like you're so fortunate to have that team kind of at your fingertips, when you need them. But when you're practicing in the community, sometimes that's just not an option. Or if it is an option, it's not going to happen, same day, next month, even sometimes. So I think I've also learned to rely on like peer support and advocacy groups, because you have a social worker, but I have people in those peer support groups and advocacy groups that know how to connect patients to the information that they need. So I rely on them a lot. While I'm waiting for my patient to get in with behavioral health, or there's no social work support. So, I'm just, I'm hoping that they can find somebody in their community that can help them. Because, the peer support provides the patient with something that I can't, because I don't have PBC. So I feel like, as much as I can empathize with them, I don't have the lived experience. And I think it can be so valuable to help to connect patients with groups of people that understand what they're going through, really understand it. I think it can be transformational actually for patients. So I try to rely on them a lot. And the advocacy groups have so many resources available and know the connections, right? So they have discussion forums, webinars, downloadable education, all kinds of advocacy opportunities for the patient. So I've had patients be diagnosed, get used to their treatment, and then become real advocates in the PBC community out there helping others, which in turn helps them. So I think that's amazing. And then lastly, like family and friends, like key supporters, right? Like you have to engage that support group, whether it's family or close friends, because it really is important to have close, a closely knit team that can understand what you're going through and be there to hold you up when you can't hold yourself up, right? So
absolutely. And that is a perfect ending. And thank you so much for joining me. And then for those, concludes our podcast. But if you need more information, please go to the GAP website or go to the GAP ACE app. There are a lot of resources on that application. And so hope to see you guys in the future.
It's been fun. Great talking with you, HoChong.
Thanks.